Hello, everybody, again with our podcast regarding TMJs. Carry on with this fantastic topic that is the topic of the most famous joint of our body, temporomandibular joint. Our famous joint. In all around the world, we know TMJs, and we know sometimes that there is a lot of confuse in all the diagnosis, treatment, symptomatology. It's difficult to explain this, but everybody see the TMJs as separate joint of our body. And that is not true. The temporomandibular joint is formed by one of the bone of the cranium, the temporal. In that bone there is the glenoid cavity, and the other part is the lower jaw, the mandible, condyle of the mandible and temporal. That means that this is a cranio-facial joint. It is not a joint, and it's part of the cranio-facial system, a particular system, very complex system that is connected with the rest of the body, and that is the most important thing to understand. We have not a joint isolated. And another question is that most of the problems of the temporomandibular joint or temporomandibular disorders, the causes most of the time are outside the temporomandibular joint. And that's why it's very important to understand the physiology. We did a podcast about physiology, and today I want to talk in our podcast regarding symptomatology. I am in different groups in the social medias where patients talk together, and I feel very, very bad when I listen to the symptomatology, the treatment they have, the chronic pain they have, and sometimes they don't know the real symptomatology of the temporomandibular joint, and that is the topic of this specific podcast. The most important thing to understand, for patients mainly, but also for medical sciences, there is the connection between the craniofacial system with the rest of the body. All in our body is connected, and some problem in the body can interfere with the craniofacial system, and some problem in the craniofacial system can interfere in our body. That's the main thing we have to understand. The dysfunction, not dysfunction of the T.M.Js, not T.M.D, the craniofacial dysfunction. This dysfunction can affect the rest of the body, and the most common dysfunction of the craniofacial system is when the jaw is losing the central relationship, the central position, the position of balance. When increase the pressure inside the jaw, and there is a podcast regarding that. You can look at the podcast and you can understand what I am saying. That is the most important thing we have to understand the symptomatology. And we want to describe some symptomatology connected with TMJs. When the people have neck pain, most of the time is connected with temporomandibular disorders, because the bruxisms started for the temporomandibular disorders create a block in the cervicals, and then we can have pain localized into the cervicals, in the whole cervical column, in the upper part or in the lower part, related with the temporomandibular joint. And that is one of the things we have to understand. Neck pain can be connected with the temporomandibular disorders. A diffuse pain, when the pain is in the whole body, muscle pain. A lot of muscle pain is due for hyperactivity of the muscle change, and the hyperactivity of the muscle change also is connected with temporomandibular disorders, because, as you remember in our podcast, we're talking about that, the bruxisms, the bad defense to protect TMJs, is creating a lot of hyperactivity in the muscle change in all our body. And also the people who have temporomandibular disorders cannot sleep deeply during the night, and that's why they wake up very tired with a problem in the whole body, due these bruxisms to liberate the T.M.J. Chronically, this hyperactivity, if the problem persists, can we go creating problem in the lumbar area, on the back pain in our colon. Some problems in the lumbars are connected with the temporomandibular disorders. Imagine a lot of problems related with something local that is temporomandibular joint. Dizziness, another symptom related with this problem in the TMJ. Why? TMJs is blocking the cervicals, and cervicals blocked is creating dizzinesses. Look at that, all connected. Our body is connected all. We cannot study just part. That's why I am saying it is not thinking in the temporomandibular joint. Temporomandibular joint is a little part of the body connected to the rest of the body through the craniofacial system. Locally, we have main symptomatology is hyperactivity of craniofacial muscles, ceterus, temporal, external pterygoideus, the cranial muscles, neck muscles, and we will do a podcast just about muscles, because any symptomatology have to do with some block into the occlusion, and that is an important podcast I will do in the future. Remember, occlusion, block, a bad position of the jaw, starting bruxisms, and we have the contacts that the bruxisms want to destroy. This action can create different kind of hyperactivity in the muscles. Imagine all the things we have to see. Another local symptom is the block of the TMJs. You know, in our body, the central nervous system, that means the director of our body, is protecting us with different methods. If we have some problem in one joint, any joint of our body, the central nervous systems block the joint. This he said, something is going bad, very, very bad. All right, I will block that joint. That's why sometimes we have a block in the opening. Our mouth, we cannot open more than a little bit. The central nervous system is creating hyperactivity in the muscles to not allow the movement, the peak movement of the temporomandibular joint. Imagine, block is a defense. But you block a joint, you create a disease in the joint, because joint need a movement. As you see, the normal defense that our central nervous system have are to an immediately action to protect, to defend our life. But sometimes these actions can create problems. Not only something healthy. Another symptom of the T.M.J's or temporomandibular disorders, when the joint is not function very well, there is the noises, opening and close. You know, when we have in our joint, we have a condyle, a cavity, and then a disc. When the mouth open and close, we have a synchronization between disc and condyle. If something happens, there is a different motives for what can happen. If something happens like this, we have an incoordination of the movement. Incoordination of the movement. The symptom is a click. The normal click we feel sometimes is incoordination of the disc and condyle. Sometimes it's regarding laxitude of ligaments. Also, I will do another podcast regarding that because it's an interesting topic also. And to understand all this problem we have inside the joint, we have proprioception. We have a podcast, a video also about proprioception. Proprioception of the T.M.Js. That send out the alarm and the central nervous system react as a normal defense. Imagine a lot of symptoms locally and general symptoms that are associated with the TMD, temporomandibular disorders. Another noise is a very big noise. If when the joint is doing crack, 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 that's very bad symptom. The click is not a very bad, but the crack, 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 it's a very bad symptom because it's a friction in the disc, and we can broken the disc. And that is a different thing. We can have a different situation that can create that noises. And that is important. Medical doctor understand, do a diagnosis, and do a real treatment for different noises. Not all of them have the same treatment. And also we have symptomatology regarding with dysmorphisms, arthrosis. Arthrosis is dysmorphisms, but is regarding with age. And then it's a different symptomatology because it's a diffuse symptomatology. We cannot have arthrosis in one joint. When we have arthrosis diffuse in the whole body. But most common symptoms of the temporomandibular disorders are locally and general, and they are regarding with the muscles, hyperactivity, pain, blockage of the joint, noises, etc., etc. I hope this little podcast will be a good tool for you patients to understand your problem and to ask help with a functional specialist in temporomandibular disorder. Functional, a function, not mechanic, functional specialist. That is functional specialist will have an holistic diagnosis, will have an interdisciplinary team, because temporomandibular disorders cannot be treated only with a bite. Can be treated with physiotherapy, osteopathy, sometimes some medication, exercises, and also different kind of bite. In our school we said, first the programming, then do rehabilitation, then do the reprogramming. And at the end, if it's necessary, you can create a good occlusion. If it's not, if you cannot, for different reasons. Because sometimes anatomy cannot allow us to do a good final rehabilitation. Sometimes patient don't want, patient cannot. In that case, you have to protect with some special night biplane, special reprogrammer during the night who protect the temporomandibular zone. I hope this podcast will be useful for everybody. If you like it, remember, do a like for the podcast, subscribe to our channel, click the bell, and you will receive all the information. If you subscribe to our channel, you will help to grow the channel, and share the information if you think it's useful information. Share with other people. And I hope you enjoyed that particular podcast, and I will see you in the next podcast in our YouTube channel, MPR International Channel. Bye bye everybody, and I hope you enjoyed that video. Do a like if you like it.